So here we are going to discuss about the chapter 2 in pathology, techniques for the study of pathology. What are the techniques for the study of pathology? We already know that pathology is the study of diseases, and now we are going to discuss about the techniques for the study of pathology. Techniques. It's the second chapter. For learning contemporary pathology effectively, it is essential that the student is familiar with the various laboratory methods, techniques, and tools employed for the study of pathology. So, first technique is autopsy pathology. Autopsy. Professor William Boyd in his unimitable style wrote, pathology had its beginning on the autopsy table. Who told? Professor William Boyd. William Boyd wrote that pathology had its beginning on the autopsy table. Pathology had its beginning on the autopsy table. So that's the importance of the autopsy. So the significance of the study of autopsy in pathology is summed up in Latin inscription in an autopsy room, translated in English as the place where the death delights to serve the living. So what is the inscription in that book? There is a Latin inscription about an autopsy, which is translated in English as this is the inscription about the autopsy room, the place where death delights to serve the living. This is the inscription. So now, traditionally there are two methods for carrying out autopsy. Two methods. Which are the two methods for carrying out autopsy? Either of which may be. First is block extraction. Block extraction of abdominal organs and thoracic organs. This is the first method in autopsy. So the first method is block extraction of the abdominal and thoracic organ. And second method is in situ. In situ means in vitro, in situ, or in situ organ. In situ organ by organ dissection. This is another method. In situ organ by organ dissection. Now we are going to move the study of the autopsy throws a new light on the knowledge and skills of the both physician as well as pathologist. And the main purposes of the autopsy are under what are the main purposes of autopsy. We discussed about the methods for carrying out autopsy, and now we are going to discuss about the purposes of autopsy. Purposes are, first is quality assurance of patient care. How the quality assurance of the patient can be done by that can be done by, first, confirming the cause of death. Confirming the cause of the death. And another way, establishing the final diagnosis. And the final stage is the study of therapeutic response to treatment. Okay, these are the quality assurance stages. For confirming the cause of death, quality assurance of patient care can be done by confirming the cause of the death, establishing the final diagnosis, and the study of therapeutic response to treatment. And the another purpose of autopsy is education of the entire team. For the education of entire team. It involves in patient care by what it involves the education of the entire team involves in patient care by making autopsy. It involves making autopsy diagnosis of conditions. This education involves making autopsy diagnosis of condition which are often missed clinically. The clinically missed things can be diagnosed in autopsy. So, in second, the education of the entire team is done by the second way is discovery of the newer disease. By the autopsy, we can discover newer diseases. For example, Reye's syndrome, Legionnaires disease. For example, Reye's syndrome, Legionnaires disease, and severe acute respiratory syndromes or SARS. Severe acute respiratory syndromes, SARS. Okay, these all diseases can be discovered while educating that autopsy. So these are the purposes. Now we are going to historical perspective of surgical pathology. Surgical pathology, there is a historical perspective. The term surgical pathology is currently applied synonymously with histopathology, morbid anatomy, anatomic pathology, and cellular pathology. Surgical pathology is the classic and time-tested method of tissue diagnosis made on gross and microscopic study of tissues. What? The surgical pathology is the classic and time-tested method of tissue diagnosis made on gross and microscopic study of tissues. And the scope and limitations of this surgical pathology is its services in any large hospital depend largely on inputs from the surgeons and physicians familiar with the scope and limitation inherent in the specialty. Thus, it is vital that clinician and pathologist communicate freely, formally as well as informally, through surgical pathology request forms verbally and at different fora such as tissue committees and interdepartmental conferences. Basic microscopy. As we know, the microscope is the basic tool of pathologist, just as is the stethoscope for the physician and the speculum for gynecologist. It is an instrument which produces greatly enlarged images of minute objects. So this microscope is like stethoscope to the physician. Microscope is the basic tool of the pathologist. And speculum there is speculum for gynecologist, stethoscope for physician, microscope for the pathologist. So it is an instrument which produces greatly enlarged images of minute objects. Here I have written microscope, pathologist, stethoscope, physician, speculum, gynecologist. And there is light microscopy. What is light microscopy? Light microscopy. The usual type of microscope used in clinical laboratories. Usual type of microscope used in clinical laboratories or labs. It is called light microscopy. In general, there are two types of light microscopes. So there are two types, which are the simple microscope and compound microscope. These are we are studying about microscope in histology. Like that, in pathology also microscope has an importance. So in simple microscope, the simple hand magnifying lens. This is a single hand magnifying lens. Single hand magnifying lens. And the magnification power of the hand lens is, what is the magnification power? We can denote magnification power into MP. Magnification power of the single lens or power of hand lens is from 2x into 200x. Okay, and in compound microscope, has battery of lenses which are fitted in a complex instrument. There is a battery of lenses which are fitted in a complex instrument. One type of lens remains near the object, that called objective lens. So the lens which are near to the object is called objective lens. there is objective lens, which is near to object, and another type of lens nearer to the observer eyes, that called eyepiece lens. Eyepiece lens. Eyepiece lens is to it is nearer to the observer. What? Nearer to observer. Observer's eye. And this eyepiece and objective lens have a different magnification. The eyepiece and objective lens has different magnification. The compound microscope can be molecular, having single eyepiece, or binocular, which have two eyepieces. It may be one or two. So if two, the other is called binocular. It is one. If it is one, it is called monocular. And multi-headed microscope are used as an aid to teaching for the demonstration purposes. Okay, there is another compound microscope called multi-headed compound microscope that is used for an aid of teaching, help in teaching for demonstration purposes. And there are several variants of light microscopy. Now we can discuss about that. And besides the light microscopes, the other modification for special purposes in the clinical laboratories are as dark ground illumination. Variants of light microscopy. First is dark ground illumination, or DGI in short form. And this method is used for the examination of unstained living microorganisms. Used for examination of unstained living microorganism, living microbes. For example, Trypanosoma pallidum. Used for the examination of unstained living microbes. And the microorganisms are eliminated by these microorganisms are eliminated by an oblique ray of light, which does not pass through the microorganism. Okay, and the condenser is blackened in the center, and light passes through the periphery, illuminating the living or microorganism on a glass slide. That's called dark ground illumination. It's a variant of light microscopy. Another variant is polarizing microscope. Polarizing microscope. And this polarizing microscope is a method to use for the demonstration of refrigerants. It is used for the demonstration of refrigerants. For example, amyloid, foreign body, FB, foreign body, and hair, etc. These are the examples. For the polarizing microscope can be used for the demonstration of birefringence. And what is meant by this birefringence? Birefringence is formally defined as the double refraction of light in a transparent. It's called, it is double refraction of light. Double refraction of light in a transparent. Okay. Molecularly ordered material which is manifested by existence of orientation dependent differences in refractive indices. Okay. And there is another microscopy, electron microscopy or EM, first developed in 1930s in Germany, has undergone modifications so as to add extensive new knowledge to our understanding the structure and function of normal and diseased cells at the level of cell organelles. However, more recently, widespread use of diagnostic immunohistochemistry in surgical pathology has restricted the application of EM or electron microscopy to the following areas of diagnostic pathology, like renal pathology and ultrastructure of humerus of uncertain histolysis, subcellular study of macrophages in storage diseases, and for the research purposes. And these are the restricted areas of EM. These are the restricted areas of the electron microscope. Okay. And there are types of electron microscopes. There are several types. There are two main types of electron microscope. First is transmission electron microscope, and second is scanning electron microscope. And these are the main two types of EM or electron microscope.